السلام عليكم أعزائي طلبة المرحلة الثالثة كلية الطب جامعة كربلاء. We are discuss and will be present the obesity from the surgical view. So surgical management of the obesity. Our discussion will be discuss the indication for the surgical obesity, whose patient we are choice for surgical management, okay, and what are the type and how to prepare the patient for the surgical management, and what are the type of the surgical management or treatment. As you know, everything it will be renewed each year. There is something new. Now we are discuss briefly what are the cause of the obesity and epidemiology of the obesity. As you know, an expanded energy store as a fat, and there is multiple factors related to the obesity, either genetic predisposing factor, eating disorder, or psychological issue and poor diet, okay, and lack of the exercise, okay, and comorbidity condition. These summarized or can be considered as a predisposing factor. The obesity will be associated with many comorbidity or some disease, okay? That means when the human being is obese may have another disease, okay, and consider as a cause of this disease. And there is some list will be mentioned, like metabolic syndrome, type 2 diabetic mellitus, or maybe patient is obese, has high blood pressure, or dyslipidemia, or maybe sleep apnea at night, or maybe patient has venous or lymphatic stasis like DVT or lymphedema, and osteoarthritis or arthritis in general, okay, and decrease the mobility and may cause chronic respiratory hypoventilation. Other, okay, may patient has hypertrophic cardiomyopathy and may be intolerant or poor quality of the life, or may patient has urinary stress incontinence or gastroesophageal reflux disease. These may your patient or the human being obese patient has some these condition or comorbidity. How measuring the body mass index? Body mass index, this summarized BMI. Body mass index, that mean body weight in kilogram multiplied by height in meter, okay, square. This measuring will be determined whose patient is obese or super obese or normal or underweight. So you can classify a classification of the body weight as underweight, okay, that body mass index, this 18.5 kilo per meter square or under. Normal should be between this 18.5 to 24.9 kilo per meter square. Overweight, that means 25 to 29.9 kilogram per meter square. Obese, that means above the 30. This can be divided, the obese, to grade 1, 2 to 5 grade. Okay, grade 1, that means 30 to 34.9. Grade 2, 35 to 39.9. And grade 3, body mass index 40. This is what's called morbid obesity. And grade 4, this 50, that means super morbid obesity. And grade 5, it is above the 60 kilogram per meter square. Indication for surgical management of the morbid obesity. So we are choose the patient for surgical management or surgical treatment. There is some criteria, okay, to choose your patient, okay, obese patient for the surgery. Either the body mass index more than the 40 without comorbidity disease, or 35 to 39 kilogram per meter square with serious comorbidity disease. And this disease, either your patient has cardiopulmonary problems or diabetic or sleep apnea or other, okay, or your patient has history minimum 5 years as obese and failure any conservative treatment like regime or any use some drugs, or your patient should be not alcoholic or psychiatric. Patient should be not psychiatric, not alcoholic, okay. Avoid pregnancy after operation at least 2 years, okay. The age limited between 18 to 55, this relative indication, and should be acceptable operation risk as preoperative assessments that when are discussed with the patient. When choose the patient, there is multiple team, okay. Should be your patient meet those team. First of all, the surgeon, and the surgeon should be pediatric training. Other, there is physician and should be interested with the obesity, okay. This physician can be evaluate and assessment the cardiac pulmonary assessment and other general as general, the physician assessed as general, and also endocrine, okay, assessment, and should be a dietitian and special nurse for bariatric surgery, anesthesia, also should be expert in bariatric surgery, and should be skilled theater staff and psychiatric, okay, should be meet the patient. And about the physician, also one of the when meet the patient, he will do to the patient endoscopy, okay, to evaluate the stomach, and also ultrasound. As any surgery should be pre-operative preparation and should be sent for the investigation. In general, any surgery should be sent, that means all the patient, whatever the type of the operation should be sent for full blood count, urea, electrolyte, sodium, potassium, and liver function test, and fasting lipid profile, fasting glucose, and if the patient diabetic, that means hemoglobin A1C, vitamin A, D, E, and parathyroid hormone. But there is a special investigation sent if we want to do for the patient bypass surgery. That means should be sent for mineral assessment: magnesium, calcium, phosphate, ferritin, vitamin B12, folate, and zinc, selenium, and copper, and C-reactive protein. This should be sent for the investigation for patient need to do for him operation. Now we are discuss the type of the surgery as a principle or summarized. We have two things in the surgery. First of all, restrictive, and second is malabsorption. So it is bariatric surgery, it is restrictive or malabsorption. Restrictive what mean? That mean limited food intake. Malabsorption, okay, that means limited the amount will be absorbed through the intestine. How choose the operation? Operation choice according to the age of the patient, to the extent of the obesity, either super obese, morbid obese, or just obese, okay? Present any comorbid condition, okay? And the surgeon and the patient is preference. That means what he sometimes patient refuse to do malabsorption, okay, or the surgeon is prefer or expert or skilled the surgeon. Restrictive. There is 5 types of the restrictive, okay, but this type already it is used previous years. Now we are mentioned or marked by blue color is sleeve gastrectomy. That means band gastrectomy, but sleeve gastrectomy. Restrictive. There is 5 types of the restrictive, okay, but this type already it is used previous years. Now we are mentioned or marked by blue color is sleeve gastrectomy. That means band gastric or vertical band gastric or gastric plication or gastric balloon, okay. All these is previously yes did. Now it is not done, okay, or about the number of the patient done, or some center done, like gastric application. There's some center in the world done, okay, by the surgeon. But the sleeve gastrectomy is still popular, okay, as restrictive. About the malabsorption, pancreatic diversion, okay, and other maybe two that mean Roux-en-Y gastric bypass. Now some pictures, okay, explain about the gastric bypass. You see here this is the gastric, there is balloon, okay, or band, okay. This will be around the cardiac or fundus of the stomach, and there is communicated by tube, and this part it will be implanted in the subcutaneous, and here will be inject, okay, by saline, and according will be inflate the balloon, okay, or band. Here, okay, accordingly will be inflate and constrict the intake. When your patient takes some food, okay, the pouch before the band is small size and he cannot eat more. Vertical band gastroplasty. Here there is a stapler, okay, and put band around the stomach, okay, and narrowing just one and that means 12 millimeter, and this operation already not done now. Now the popular is sleeve gastrectomy. Here it will be cut near the pylorus sleeve and cut by stapler, okay, and this remove the outside the body and keep this part of the stomach, okay, like a tube. And you see there is here during operation, this is what's called bougie, from size of the bougie from the 32 to the 36, and after finish the operation this bougie is removed. Gastric Plication, as I mentioned before, it is not resect any part of the stomach. It is just suturing and invaginated inside, okay, inside the stomach. And some center did this operation. Other gastric balloon. This gastric balloon also still they did. That means insertion through the endoscopy balloon and inflate by saline and keep this balloon at least 6 months to 1 year according to the company, and this help to feel the patient about the fullness. Other type of the surgery is malabsorption. That means resect the body and pylorus and suturing this duodenum, and also the cardiac and fundus stapler, and then elementary limb 2 meter, and the common channel, that means half meter, okay. This is the biliary limb. Here also there is some complication may be happen with the patient. Other picture here, it is also elementary, okay, 1.5 or 2 meter, 2.5, and common 1 meter, okay, and biliary, well, that means secretion of the pancreas and biles will come through this intestine and meet here with the food come from this stomach, okay, to this part. Here the absorption will be limited. There are Rho and Y gastric bypass. This is, okay, anastomosis elementary intestine, and the biliary limbs, okay, connect between this limb, all right, and what's called Rho and Y. This is not important for you, just to take some review, okay, about the type of the important to know there is restrictive operation and other it will be what's called malabsorption. Mini gastric bypass also, some center they did. It is cut near the lesser curvature and put restricted, and without cutting the duodenum side, and then it will be anastomosis with the pouch of the gastric pouch. It is what's called single anastomosis. What are complications? Any surgery there is complication. Just will be mentioned the complication. Okay, of the sleep. The complication of this bleeding from the short gastric or spleening or from the stapler line, this intraoperative or postoperative immediately. Okay, other liver injury, spleen injury, okay, and leak. And the serious, all this is serious one, and everyone needs some interference and management. Thank you to your attention and listen. Thank you.